It's time for Tab Talks, your weekly conversation about matters of faith. I'm your host, Jennifer Rash.
And I'm your co host, Debbie Campbell.
February is National Cancer Prevention Month, and we are going to talk about cancer care ministries through churches and individuals. And joining us to discuss this topic is Reverend Percy McCray Jr. from the Cancer Treatment Centers of America. Welcome.
Hi, Jennifer and Debbie. How you doing?
Great. Good to have you with us.
Well, thank you for having me. It's my pleasure. Thank you so much.
All right. So you are the Director of Faith-Based Programs at the Cancer Treatment Centers of America. So we got lots of questions about how churches can get into cancer care ministry, how individuals can be involved, and all of that. But before we go there, let's hear a little bit about your story, because I understand you are also a cancer survivor.
I am indeed. So thank you again for the opportunity. Yeah, I've been working at the Cancer Treatment Centers of America now going on my 25th year in the capacity of providing spiritual support for cancer patients and their caregivers at, again, the Cancer Treatment Centers of America. And my story is a very interesting story. I did not have any real intention on doing hospital ministry, went to Bible college to be a traditionally trained pastor. Third generation pastor on my mom's side of the family, and that was my goal. But shortly after I graduated from Bible school, I was living in Tulsa, Oklahoma, and an individual who worked for a healthcare organization, the Cancer Treatment Centers of America, approached me and asked if I would be interested in doing hospital ministry with cancer patients. And I hadn't talked to many people or known of many people that were doing that type of ministry 25 years ago. And so long story short, took an opportunity and a chance and almost missed God because I was a little nervous about, well, I don't know if this is really what I want to do. And I really want to be a pastor and this, that, and the other. And so here we are 25 years later, but in the midst of literally supporting hundreds and thousands of cancer patients, preaching, teaching, doing interviews like this, TV, radio, magazine. I've been talking the talk of cancer for a very long time, but about a year and a half ago, I received a cancer diagnosis, early stage colon cancer, where I had 1/3 of my colon removed. I tell people just call me Pastor Semicolon, just to kind of lighten the mood. And it was caught early, detected as a result of some symptoms that I was experiencing that I knew something wasn't correct. Had a colonoscopy and an endoscopy, and sure enough, I had a golf ball size tumor on the right side of my colon that needed to be removed. And so we had that taken care of. It had not broken through the wall of my colon, so it did not spread, thank God. Had several of my lymph nodes looked at, so I was clear and my margins were good. So I had surgery. I have not received any chemotherapy or radiation. So I was very fortunate because we caught it early. But I am now in the club, and I tell people who ask me, how did you feel when you heard those words, you have cancer? I've talked to many cancer patients. I have my own podcast where I interview cancer patients and their caregivers, and I ask the question of them all the time, what were you thinking and how did you feel when you were told that you had cancer? And I now know what that feels like. And I can tell you that my reaction and my thought was that, well, I guess it's just my turn. And more than that, I felt like in a very interesting way, because I have been talking the talk. I've developed a training program on how to support cancer patients for 20 plus years, that in some ways, this was allowed to take place so that I could more authentically, not that I was not authentic, but I did not know that experience from a firsthand perspective. And so now I get to talk about cancer from a firsthand perspective. Now, been there, done that, and I have the t-shirt. And so I'm part of the club, and I count it a privilege and an honor, because cancer patients are some of the most resilient and some of the most courageous people in the world. And we know that cancer is or was the malady of the day before 2020, which is another conversation within itself. But according to the American Cancer Society, 1 out of 3 people are estimated to be potentially diagnosed with cancer at some point in their lifetime. So think about the next time that you're in a social gathering and there's more than 3 people sitting in that room together, potentially, according to the American Cancer Society, 1 out of 3 of those people may be diagnosed with cancer at some point. So those numbers are large, they're real, and they should not be ignored. And so that's part and partial the motivating factor that now really drives me and gives me even more enhanced purpose with the ministry that the Lord set before me 20 plus years ago.
Mm. You know, that stat you're giving there, you know, it makes you hear a lot of times people say that we all know somebody with cancer. We've either had it, or one of our close family members, or at the very least a close friend. So
Yes.
so it is proving true that it is everywhere. What are you sensing through all the different people that you run into through your ministry and through the years? Is there a common thread with these families?
You know, that is an interesting and it's a great question. And the fact of the matter is, there are some potential things that appear to suggest that could be consistent with, by and large, many cancer diagnoses. But according to the data that is published, the American Cancer Society, NCBI, and other cancer organizations, number 1 on the top of the list to be considered is weight gain, obesity. Obesity has, in some cases, a direct correlation with cancer proliferation and an association. The second would be dietary practices of the things that we just simply ingest, that we eat, that may be compromised for various different reasons, you know, whether it's agricultural, et cetera, things that simply we need to be more aware of and mindful about with regard to our diet. And certainly from a colon cancer perspective, that was one of the things that my GI and I sat down and talked quite a bit about in looking at. Stress may have some association with regard to cancer proliferation. So there are some things to be mindful of, that there has been some research that has suggested a possible correlation with cancer diagnosis, particularly in the United States of America.
Well, I'd like to ask you too, as in your own personal walk through cancer, as you said, you know, yours was caught in the early stages, but still, you were one of those that heard the letter C. How was your walk through this? What are some things that helped you personally?
Well, number 1, you know, again, I have a very unique story and a unique journey. And one of the key elements that has been huge for me, and I've talked about this publicly, even on my own podcast, shameless plug, Health, Hope, and Inspiration. For those of you who are interested, tune in and listen. We have over 300,000 subscribers. And so we talk about cancer all on every program. And one of the episodes, I share my story. And one of the things that helped me prolifically was the fact that I've been doing a dress rehearsal, because I've literally watched and listened in on cancer patients for 20 plus years. So there wasn't anything that was really said to me that was new or different or shocking, because fundamentally, for lack of a better expression, I've heard it all, I've seen it all. So when that conversation came to me, it was just the ability to absorb the realization that that was me that this conversation fell before, and it wasn't someone that I was supporting. And I took a moment to kind of stop, drop, and roll, as they would say, to kind of process that. And once I was able to do so, then obviously my faith, you know, part of everything that I've done in this community and in this conversation is the fact that cancer is not bigger than God. So when we say the C word, you know, or the big C, I tell people the big C is only reserved for Christ. So we've got to make a determination who's going to get the big C and who's going to get the small C. So the determination is that cancer gets the small C, Christ gets the big C. And so changing the vantage point of how you look at and see cancer, like David when he fought Goliath, changes how you approach that and how you stand before what may appear to be a giant that is trying to overtake you. And David reminded himself that he said, I'm going to go face the giant in the power of the Lord. Well, when we say that, and I want to be very clear because I work within a healthcare organization. I am not subscribing that people do not adhere to good medical practices. One of the things that was very beneficial for me, as you alluded, is that I listened to signs and symptoms in my body. I knew something was not right. And yeah, I did pray about it, but I also went to a physician. I went and did something about that. I took a look to gain some insight. And once I was able to establish what was actually going on, with prayer and with my faith and good medical practices, I was able to then create a game plan that allowed me in this particular case to stand today and say that God is good, I'm alive and well, and I have nothing but a healthy prognosis. But the rehearsing of all of the scenarios and conversations that I've had with literally hundreds of thousands of cancer patients was a huge help for me. I've sat in that class for 20 plus years, not knowing that one day I would become a student of that subject.
You're listening to Tab Talks. I'm your host, Jennifer Rash, with co-host Debbie Campbell. We are talking with Reverend Percy McCray Jr., who is the Director of Faith-Based Programs at the Cancer Treatment Centers of America. Reverend Percy is sharing with us, or Reverend semicolon, I should say, is sharing with us about his story and how we all can think through this. You know, you referenced your podcast. What was it again? Health. I'm not going to remember. Hope, and inspiration.
Health, hope, and inspiration.
All right. So why do a podcast on cancer?
Because nobody else at the time was doing it. No one else thought about it. And this raises a fundamentally important point. And the same thing is true with regard to why I started a cancer care leadership training program, because literally, historically, cancer has shut the mouths of people. We didn't talk about it, or when we did, we spoke about it in very hushed tones, whispered, as if cancer was going to overhear us. You know, like a bully, if it hears us, it's going to come and get us. And so this inherent fear of the reputation of cancer literally handicapped us as a community of people. Even in the faith community, we didn't talk about it. We didn't share that. We didn't tell anyone. And so that hurt us, because the scriptures tell us that my people are destroyed because of lack of knowledge. We had to change the paradigm. And so one of the things that we did is that we're going to fill in a gap of communication about a subject, as alluded to earlier, that we are all touched by. Cancer is a community disease. I'm going to say it again. This is not an individual sport. One person may contract cancer, but their entire community and their village is impacted by that diagnosis one way or the other. And so we have been ill-equipped because we simply would not open our mouths or have courage enough to talk about the subject. So we decided to do something about that. So we started a training program, and then I said, let's start a podcast and let's talk about only cancer, and talk to cancer patients, their caregivers, as well as clinical doctors, nutritionists, to give us insight around the world of cancer so that we can lower the wall of silence and get up and talk about this openly so that we can be empowered and not sit and wait for the bully to jump on us. And when we do that, we typically are fighting from behind, because now we're being reactive versus being proactive.
Nice. Yeah, I'm sure the audience there is going to be very engaged with you at all points and constantly changing.
Well, first of all, every cancer patient, let's start with this. Every cancer patient has a story to tell. The question is there someone willing to listen? Well, as we have found out, not only do cancer patients have a story to tell, but there are those who are engaged in the journey, or who have been engaged with the journey, who wants to hear what other people's stories and journeys have been. So all I have done is create a bridge. I'm just a bridge between the two worlds of those who are walking the journey or who have walked that journey, and those who are either on the journey or about to enter into that journey. And I have connected those two together to create a very what we believe is a very effective and powerful media mechanism, talking about the subject of cancer and how to be hopeful and healthy mentally, emotionally, physically, and spiritually as we confront this enemy called cancer and declare that the best is still yet to come.
Well, I'd like to know how churches can get more involved and, really receive training. Because, like you said, everyone, if you're in a church, you've got multiple people in that church with cancer or someone experiencing it. And so that is really something we all need to be more aware of and equipped. So,
Correct.
can you share some of those ideas with us?
Absolutely. First of all, let's lay the groundwork. We now have had very high profile spiritual leaders within the evangelical faith community who have publicly come out and said either they have had cancer or their wives or their family members. Tony Evans comes to mind right away. And he and his wife did something that was very courageous. They went public. They talked about it from day one. They chronicled their journey, their process. They didn't hide. They didn't shrink back from the conversation. And of course, we know that Sister Evans passed away. She did not survive. But they were very forthright. And so part of the dynamic is that whether we talk about this or not, or whether we are equipped to have this conversation, we are seeing cancer inside of the four walls of the local church. On any prayer role that you have inside of any local church, I promise you, there's at least 2 or 3 people that are on their prayer request list that have cancer. The question is, and not only they, but their pastors or their pastors' wives. What am I saying? Well, we cannot be ignorant and be silent because we just don't want to talk about this subject because it's sitting right before us. And so Matthew's Gospel, the 25th chapter, tells us that we're supposed to do some things that we're commanded by God to do. We're supposed to feed the hungry. We're supposed to clothe the naked. We're supposed to visit them that are in jail. And we're supposed to take care of the sick. We're supposed to attend to the sick. And not just through prayer and not just with a casserole. There are some components practically that we need to understand. Number one, the language of cancer, how cancer operates, some of the clinical options and opportunities, and the ability to psychologically and emotionally partner with someone inside of our local church beyond just praying for them on Sunday morning. And now that we see the proliferation of this, the good news is that the death rate of cancer has gone down drastically in the last 20 years, but we are still seeing more people being diagnosed with cancer. People are living longer, but that means they need more support. They need to have informed and engaged individuals who have some techniques that will allow them to be encouraged and equipped to walk that journey. And that's why our program is called Our Journey of Hope. And so for anyone that is interested, please go to our website, ourjourneyofhope.com. All one word, all lowercase letters, our, not the, not a, ourjourneyofhope.com. And you can find a plethora of resources and online virtual trainings that you can sign up for throughout the year, that you can receive our free curriculum, our online booklets. Everything that we are offering is all free of charge. We now have churches that have been trained in the United States, in Africa, in South America, in Europe, the UK, the Caribbean, Canada. We have close to 2,000 churches now that are utilizing the Our Journey of Hope curriculum and reaching out to their community. So ourjourneyofhope.com, and you can look at our schedule, you can register online. Everything is free of charge.
So why would churches not have a cancer care ministry? I mean, it's the low-hanging fruit, really, right?
It is, because of the previous point that was made. Fear, just fear of the unknown. In many cases, pastors have confessed to me behind closed doors that they were afraid. They simply didn't know what to say or do. They did not have resources. And so when we started this program over 15 years ago, we polled pastors throughout the United States and asked them what were their three biggest areas of need for ministry. And on the top of the list was marital, relational resources, financial, as we all know. And then the third area that they mentioned was healthcare and specifically cancer related resources and tools. And it was the area that they said we know the least about and that we don't have any resources for. And so it helped us to understand that there was a void and a gap in the world of ministry to provide instruction and insight that then will equip the local church so that they can raise up cancer care ministry. So part and partial, it's just a fear, and it was a sense of a lack of resources. And in some cases, I hate to say spiritual arrogance. I remember in the very beginning when I started knocking on doors, just setting up my little tent saying, listen, can I come and talk to your church about cancer? I would have pastors who would tell me that they had that under control. And I would say, well, what are you doing? Well, we pray for our members at our church. We're good. And I was like, well, no, you're not. And the statistics bear that out, and that you need more and better, just like the children's church, just like the choir, just like the parking lot attendants, all structured, all organized, teams. You need and we need to have a focus of cancer care ministry that is committed to inside of the local church. And the good news is that the Lord has given us favor over 15 plus years with a lot of hard work, that again, we are reaching churches literally around the world.
When you mentioned it's more than just prayer and taking a casserole. So just some of the specifics, if a church is wanting to get involved and be trained, other than, okay, it's not enough just prayer or the food, what else is involved?
I'll give you a couple of little snippets of we have an 8-chapter curriculum that we created based upon the bedside work that I and a fellow chaplain performed for many years. So this is all based upon experience of what we've done, not something that we heard. One of the chapters deals with the subject of caring for the caregiver. Focus is always on the patient, and rightfully so, but we forget the fact that no successful cancer patient has walked the journey of cancer without having someone that is with them morning, noon, and night, wiping their forehead, checking their prescriptions, helping them keep their appointments, taking notes for them, et cetera, et cetera. So no one understood that the caregiver needed to be cared for. So we've created a chapter on how to care for the caregiver so that they can care for the cancer patient, as an example. Some other information, how to do an effective hospital visit. People think that they know how to do a hospital visit, but they really don't. There are rules. There are certain things you should say and do. There's certain protocol that needs to be followed when you go inside of a local hospital. So we provide that insight and that information through this training. And then something that we call, what is cancer? Anyone that is talking to a cancer patient and supporting a cancer patient needs to understand the basic language of cancer. If you've ever traveled outside of the United States to a foreign country, you learn some words, where the bathroom is, where the airport is, where the restaurant is. You learn that language quickly because you need to navigate and move about in that environment, but it's foreign to you and you have to learn that. It's not secondhand. So we provide actual insight from physicians and oncologists within our organization to step the cohort through some terminology, some phraseology, so that when you start hearing certain terms like metastasis, you're not sitting there dumbfounded trying to figure out what does that mean at the end of the day, because we need anyone that is supporting cancer patients to be engaged, locked in, and on some level knowledgeable of some of the things that's part of that world and that environment. And that's just an example of a few things. Knowing your enemy is what we call that chapter. You can't fight your enemy unless you know who he is and how he operates. And there are certain things that we should know and understand about the movement and the activity of what cancer actually is and is not. So that's just a small snippet of what we actually train individuals on and with the curriculum that we provide to them. Again, all free of charge.
Well, Reverend Percy, thank you for what you do and how you've invested your life I can't imagine the number of people and ministries that you've impacted. So thank you for what you're doing.
It has been a thrill of my life. It's been the greatest joy that I've ever done. And so thank you for having me. I want to remind everyone that I have a podcast as well, healthhopeandinspiration.com. All one word, healthhopeandinspiration.com. We were just told that we're in the top 2% of 1,800,000 podcasts in the United States of America. So I'm very happy about that. Check out healthhopeandinspiration.com. And if you're interested in free cancer care leadership training, if you're a senior pastor, if you are a lay leader in your church, if you're an associate pastor, go to ourjourneyofhope.com, all one word, all lowercase, and you can sign up for one of our free virtual online training sessions and become a member of this growing group of cohorts, 2,000 churches strong now throughout the world that have been trained to go out and fight cancer. Because at the end of the day, I read the book, I cheated, I got to the end and read, and we win when it's all said and done. And so, but we've got to occupy until he comes, and we need to be equipped to do that right here and right now. So we've got work to do. So let's keep chopping the wood. God bless you guys.
All right. Well, thank you. Ourjourneyofhope.com. Thank you again. And thank you all for listening. We'll be back next week.